So let's talk about the evaluation management of diarrhea in a patient that's on immune checkpoint inhibitor, and particularly for those individuals with kidney cancer, because those individuals, such as yourself, are more at risk because of the prior partial or radical nephrectomy. Your kidney function may not be what it was previously, so you may have some degree of what is referred to as chronic kidney disease. So your BUN and creatinine may be higher because of that. It's important for you to maximize your fluid intake, making sure that you're getting in 60 ounces of fluids. It's important that you manage diarrhea and communicate the onset and changes of diarrhea with your oncology team. So if you're developing diarrhea, follow the guidelines that your oncology nurse provided you with, which might include the use of Imodium. But if within 24 hours you're still having diarrhea, you need to let them know. And what do I mean by diarrhea? That's really a change in the frequency or consistency of your bowel movements. You and your oncologist and oncology nurse probably talked about what your baseline or pre-treatment bowel function was. How often do you have a bowel movement? What is the consistency? So 3 or 4 mushy stools a day for someone who normally has very solid form stools needs to be addressed and evaluated. It may very well simply be a phone call that says, yes, okay, we're aware of the change. If it changes further, please call me back. You've been given information on the use of Imodium. It's important that you follow those instructions because kidney cancer patients are more at risk for dehydration. So those are the key things to remember as well. You should have instructions on when to call and making sure that you're aware that there is an after hours, weekend, and holiday contact as well. Even if I'm not in the office, it's important that my patients know who to get a hold of and how to reach them. Because diarrhea doesn't just happen Monday through Friday, and you can get into trouble over the weekend if you don't follow up and let your healthcare team know about it. It's very important that if you have abdominal cramping, you notice mucus in the stool, fever, chills, or a change in the color of the stools, that you let your healthcare team know about that immediately. So those also important changes that alert your oncology team that they need to evaluate things much more. That may include blood work. That may include being recommended to be seen in the emergency room. They may do a CAT scan. They may recommend a colonoscopy or referral to gastroenterology for further evaluation. So there's a lot we can do, but the key thing with diarrhea is we can't do anything if we don't know you're having trouble.